Hi everyone, welcome to Health First. Today I'm here with Aleksandr Dekhtyarev, who is a doctor of physical therapy. Hi Alex, how are you?
I'm doing great. How are you?
I'm good. I would
Thank you
like
for having me.
Thank you so much. I would like to start off by asking what influenced you to go into the medical field.
Great question. Something that always enjoyed helping people since I was a little kid. If someone would get hurt, I would be the first one to kind of jump on to help them out. But volunteering, definitely volunteering. I started volunteering in hospitals and the private practices to make sure that this is something that I like, that I enjoy. And the more I volunteered at different locations, I did realize how much I love medical field and physical therapy in particular.
Tell me a little about your profession.
So our profession is very like broad in terms of who we can work with and where we can work with. But to kind of sum it down is we do rehabilitation in the gross motor functions with people. So our profession, we can be working with little babies if they have like such something like early intervention, if they have problems as um, with the development or something is happening with their neck or their feet or their hands. So we could be working with that. We could be working with athletes from high school to college to professional athletes, whether it's football or basketball. While they get injured playing the sport, we try to get them back to return to their function, to go back to their career. And there's outpatients. This is for anyone that just gets hurt, like your working class, your elders, your younger, and you have hospital. This is usually the kind of more severe cases. So basically, our profession is very broad, working from little kids to adults, and that's something that just kind of drove me towards the profession.
hmm What do you like most about your profession?
Um, I like the smile that I get on a patient after they feel better. When a patient walks in, let's say after surgery, or not being able to walk or move around, and after a couple of months, they're able to get back to their sport, or they're able to go to work, or basically their daily function without restriction. Um, that keeps me going. I definitely enjoy the fact that somebody came in, we'll call it quote unquote broken, and then they're walking out and going back to the things that they love doing.
Yeah. What is the biggest challenge in your profession?
The biggest challenge, oh boy, um, I would probably say today is that administrative aspect of healthcare in general probably became the biggest challenge, not just for physical therapists, but I think for all healthcare professionals.
Mhm.
Dealing with the insurances, dealing with the paperwork, um, that's probably the biggest challenge, I would say.
How was it like working during the global pandemic?
Great question. Um, so, I'll kind of back up a little bit. Like back in college, I used to work on the ambulance as an EMT. So personally, obviously you have uh, the fear that everyone kind of experiences. Personally, I was okay with it. Obviously we have the right protective gear, which is our face shields, our masks, our gloves, wiping down, cleaning after every patient, making sure that you're safe and you're keeping your patient safe. So you don't want to have if one patient by any chance had it, and for them to kind of pass it on to the next one. So you're taking extra precautions and you always keep that in the back of your head. So from that perspective, it's I would say it's a little bit tough. It was tough, keeping the staff and the patients calm and explaining that to them. But for most part, it was a regular day at work. We're there to help our people, and we still kind of got our patients better.
Yeah. How are you able to help people during this difficult time period?
Um, kind of like what I mentioned before, we always focus on patients. We don't focus on our surroundings or We try to ignore that administrative, the pandemic, things like that, and we just focus on why is the patient here.
Mhm.
There's a reason why someone, got up in the morning, got dressed, drove, walked, got carried to a place. It's usually because they have pain.
Mhm.
And when we focused on getting them better, getting them stronger, and getting them back to their life is what kind of keeps us going. So you just focus on the good. I would say that's the biggest message. I would say you kind of you focus on the good,
Mhm.
and you don't just you know try not to get distracted by all of the crazy things that are happening right now.
Yeah. What do you see in post-COVID patients, and how are you able to help them specifically?
That's a great question. So I would say, obviously, during the peak of the COVID, we did not know a lot of the things that kind of were happening. But as as a lot of the patients started recovering from the COVID itself, we noticed that a lot of them have either difficulty breathing, when they get shortness of breath quickly, and this is even the younger population. So one of the things that we focused on with the post-COVID patients was to do some chest physical therapy, which is basically when you have some scar tissues in your lungs, so prevents from your lungs from expanding and basically opening and closing. You have that scar tissue there. So we worked on, again, using the chest PT, different manual techniques, postural reeducation to try to get them to breathe better, which I would say that was one of the big things that we've noticed with the patients post-COVID is they're having difficulty breathing. If they were able to tolerate exercises for a longer period of time, now that time has decreased because they would just get fatigued or they get out of breath.
Yeah.
So I would say that was probably like one of the big things that we saw after the COVID patients. I mean,
Mhm.
after the COVID.
Yeah. How can you give a few words of advice to the people of my generation hoping to go into the medical field?
Um, Yeah, absolutely. There's obviously just like every field, right? There's the good and the bad. I think the medical specifically has way more good than bad. At the end of the day, right? You're doing a noble profession where you are selfishly putting yourself on the line to help someone else in pain, someone will dysfunction, someone to get them back to their work, to their families, to take care of their kids. So I think medical is definitely a very noble and a very respectable profession. Um, you have to love what you're doing in order to go to medicine, because you do put, I guess, your even though you have to kind of leave your emotions at work, but you do take some of the patients mentally home with you, and that's why you gotta love what you're doing. I think definitely it's a great profession to go into it. You got to be dedicated, you got to be patient, you have to study hard.
Yeah.
um, you will be right because that it is competitive, so you have to make sure your grades are top notch.
Mhm.
um, but the biggest advice I can give is go out, volunteer. Go out, volunteer for physical therapy, for occupational therapy, for chiropractic, for medical doctor, for a surgeon, for an eye doctor. Basically, go out, see different aspects of um, types of medical professionals out there and type of different settings. Like, I'll give you an example myself. Like, I ended up in the outpatient and working in early intervention with little kids, um, because after doing many volunteering settings, like from the hospitals to acute to traumatic brain injury, just being an outpatient brought me closer to the patients, and working with kids is just fun. So
Yeah.
that's how I ended up with kind of the two specialties.
Hmm. Thank you
Uh,
so much for joining me.
you got it. It was my pleasure. Thank you for having me.
Thank you.
Uh, Good luck.
Nice day. Bye.